I think first of all we need to realize a tooth is a tooth. It doesn't matter in what species of being it is in. And most mammalian species all have the same gross anatomy or morphology as they are adapted for certain diets. Obviously the teeth are adapted. Now this is a carnivore, so the teeth does look different to what our teeth would look like, but the structure is the same. So it also has blood vessels on the inside, it also has a nerve on the inside, and therefore if they damage a tooth, the consequences to that tooth will be exactly the same as if it was a tooth in our mouth. So in a situation like Africa, where you have cheetahs that are in captivity, you've basically taken over the role of what nature would do in, let's say, a big game reserve. So you've decided, for whatever reason, that these animals are now in captivity, and that we would take control of certain things. We would vaccinate them, we would deworm them, and then it is an all or nothing process. You have to look after the health of the whole animal. It's no use to say they're in captivity, but we will only treat certain parts of what goes wrong with them. If they break a leg, we'll fix that, but if they get a toothache, we're not worried about that. They obviously get problems with their teeth, and therefore we have to treat the problems that occur. And in this case, we've got two fractured canine teeth. It's teeth that have got quite large roots, they go right up there. So to remove them, we have to cause quite a lot of trauma to the patient. But if we do a root canal treatment, it is much less trauma to the patient. They keep most, as in this case, most of the teeth, or most of the tooth is still there, and they can actually still hunt with them. Now they're not, the diet that they get fed here is obviously a standard thing, but they still do run around in the big camps, and they might still catch smaller prey, and that's just in their nature. And with them having all the canines they require for that, they can obviously still carry on with this behavior. That is apart from the fact that these things is infected, so that infection will eventually go into the bone, will form an abscess, may lose that tooth. He obviously is going to be chronically ill until that happens, because of this chronic abscess that's not draining, that's not going away. And therefore it's just the best way to treat this tooth at this stage. That is one of the problems. You know, humans don't have to be anesthetized, or most humans would not be anesthetized for every visit. These animals would, and obviously at some stage we have to say what is going to be more detrimental to the animal, having multiple anesthetics or having one anesthetic and doing a thorough job. As I said before, the anatomy of these teeth differ a bit from human teeth, and therefore I can actually feel when I am at the apex. Part of working out in the wild is often that we don't have exactly all the equipment we would like to have, and one of them would have been an X-ray machine. That's always will stay the most effective way of knowing exactly where this file is. We don't have it available at this visit, so we do without it for now. But so far in 10 years, those animals that I've done root canals on all have had very good success. I've only ever had one failure in a dog, but we do visit these animals and we do an annual health check. So obviously if there's problems with the tooth, we will pick it up at that health check, and then we will carry on doing the necessary treatment.